now we are giving the floor to Neville Calleja, who is a director from the Directorate for Health Information and Research from the Ministry of Health in Malta. Neville, you have the floor. Thank you.
Thanks, Dr. Briand. Thanks, it's a big pleasure, obviously, and the big responsibility to having been assigned this job. But I will try to reflect as much as possible, as accurately as possible, the reflections of the health track. I have a few slides, if I'm allowed to share them. Yes, so I've split my presentation into three. Basically, first, the challenges that countries felt that they had to face during this pandemic, especially related to the infodemic. So we were basically faced with a novel challenge, with a complete vacuum of knowledge. The same vacuum of knowledge paralyzed our responses. Countries were crying for advice also from international agencies that obviously were equally paralyzed, because this was a new challenge which required to get evidence to be gathered before any advice could have been formulated. Needless to say, being a new challenge, it meant that new evidence was being produced at a record speed all the time, and advice had to reflect that new evidence. This was sometimes, obviously, not sometimes, but a lot of the time, attacked by misinformers, conspiracy theorists, as showing weakness rather than responsiveness. Added to this was, in a way, part of the response, which also presented a challenge. So most research venues, most research channels were actually fast-tracking publications pre-peer review. And we've seen also some not so good research making it quickly into the public domain in the hands of people who were not trained in scientific discourse, in critical appraisal, or in systematic appraisal of research. If I can point fingers towards ourselves, as in the countries, we've also seen several of our governments expressing dissent between different parts of government in the public domain. And many of us believe that this was highly correlated, so to say, with the grip that the infodemic had on specific populations. And a final challenge, I'm sure there's many more, but I'm trying to stick to the main ones, was basically the incredible reach of social media across borders, and how social media was spreading misinformation, which was then spilling over very easily into other conventional media, into news outlets, radio, TV, even the mouths, so to say, of influential people within our countries. In terms of response, we had an interesting summary of presentations within our track, and I've selected these five particularly. So Canada presented the setup within Immunize Canada, and we can see a clear example here of early acknowledgement of the threat of misinformation. And by early, I mean 25 years ago, actually. So hats off here to Canada for acknowledging the contribution of misinformation to the control, or the lack thereof, of epidemics. We saw an example from Finland how indeed infodemic management and engagement does not necessarily need to cost millions, but there's a lot that can be done within existing capacity. We had a brief also from New Zealand, and I think one striking feature there was how even briefing the Prime Minister herself involved actually an overview of infodemic trends. And I think we all acknowledge the success shown by New Zealand in the control of the epidemic. So I leave it up to people to conclude whether they could have been correlated or not. We had Niger presenting before. He also explained how this cycle of evaluation and resultant action has been instituted in Niger. And finally, we had the Philippines showing us how they are trying to saturate, and that's the word they've used. I've tried to quote it as best as I could, saturating media with the right messages. I think you all understand how the combination of human nature to share the bizarre and also algorithms within social media tend to saturate media with the wrong messages. So this is clearly one of the tasks that's in front of us as infodemic managers. And needless to say, I have to highlight, Tim has presented earlier on the WHO response. I am lucky enough to have been involved by WHO earlier on in this journey, a very short journey, as Dr. Ryan has explained earlier. We only started in summer on this, and since then we have a fully fledged strategy. Training has been completed. A 4-week intensive training course has been completed for just under 300 infodemic managers coming from across the globe. And I'm happy to note, as a country representative, as a member state representative, that infodemic management is something that is becoming more and more mainstreamed. And listening to, for example, the Council of Prime Ministers within the EU speaking about how the infodemic is threatening the response to the pandemic is definitely one major sign of success here. Finally, what next? I think most of the representatives felt that we need to have more acknowledgement of infodemic management actually as an important non-pharmaceutical intervention. All right, just like any other public health measures that we have instituted in the country, I would possibly push it that this would be the mother of non-pharmaceutical interventions, because without it, other non-pharmaceutical interventions might fail because of non-compliance. There was a clear appeal to listen to constituents. We need to listen to the people out there. We need to contextualize our messages. That's the only way to build relationships and trust. We can work with existing systems and health systems. Everybody can do something, as I explained earlier, and I think our Finnish example earlier on was very encouraging. And we definitely need to start looking towards the future to build resilience for future emergencies, to tackle misinformation, and proactively rather than reactively. One very, very strong message that came out from all the speakers in the health track was the need to evaluate. Evaluate comprehensively and rapidly. It doesn't have to be perfect. It doesn't have to be 100% rigorous, but we need the good feel of what's happening out there in order to be able to respond rapidly and in time. And allow me to conclude that misinformation is not about censoring messages out there, but rather about sharing the right information. The chaff spreads itself naturally. Unfortunately, we need to engage in spreading the wheat. And that's all that we had to present from the health track.
Many thanks, Neville, and it's really great to see that many countries have already put in place a number of interventions. that those solutions are contextualized, but at the same time, they can be used in other settings. So there is a value in sharing our experience, of course. You highlighted that everyone can do something about it, and I think we all agree, and all those who are listening to this conference agree about it. And also, we understand that we are fighting now this current COVID-19 pandemic, but there will be other pandemic, other epidemics, and what we need now to do is also build resilience, so that next time we are more equipped to manage infodemic in a better way. And finally, you said that something very important about evaluating what we do. And it's true that we have started to do things a little bit ad hoc, I would say, but it's really time now to put in place some strong evaluation system, even if we start small, because it's what is important is to start, and then we can, of course, expand and develop more sophisticated framework as we go. And finally, I think your point of not censoring, I think it's very important, because it's true that during this pandemic, we have listened to many different voices and sometimes dissent opinions. And the tendency has been in some places to suppress those dissent voices. But we know that it's not the right way forward, and it's better to collectively try to build up the good information that will help us also to build trust in the population. So thanks a lot for this wise word.